Welcome to our show, Let's Talk Health. To know more about your health, you can subscribe to YouTube channel or Facebook or the Twitter handle of Healthwire Media. To have discussion about prostate problems in men, we have with us a very eminent urologist and kidney transplant surgeon, Dr. Anil Mandhani. Welcome, sir.
Hello, Doctor.
So,
Thank you.
Dr. Anil has been also a professor at SGPGI Lucknow and ex-chairman at Medanta Hospital, Gurugram. So, sir, prostate problems are increasing because of so many factors, like one of them is age, one is family history and so many others. So, what kind of prostate problems do you encounter in daily practice?
Yes, as you rightly said that with increasing age, we are having more and more elderly people in that age group, and prostate usually creates problem after the age of 50 years. Prostate gland is important in youth because it gives nutrition to the sperms. So, after the age of reproductive age, it usually doesn't have any function. It creates more of nuisance than benefit. So, after the age of 50 years, men usually have change in pattern of urination, like they have reduction in flow, they go to the loo quite often, and maybe they wake up number of times during the night. So, any change in a routine of peeing, a routine of passing urine should be addressed to, and I think men should consult a urologist. So, broadly we have two kinds of problems. One is we call it non-cancerous. In a common parlance it is known as BPH or benign prostatic hypertrophy, because prostate gland usually enlarges after the age of 50, and by the age of 80 or 90 maybe almost 80% of men have enlargement of the prostate. But enlargement per se does not mean that a man would have symptoms, because it is always not proportionate. So, symptoms are not related to the size, but they do happen with increasing age. And BPH, I have seen in my practice that lot of men who are consulting urologists or maybe general surgeons, they opt for surgery. We call it it is done endoscopically or in a routine way. They know it by laser prostate surgery. So, ultrasonography is one of the tests which is usually recommended, and if that shows increase in the size of the prostate with mild symptoms, it doesn't mean that a person would need surgery. This problem can be tackled with medicines. So, there is one important point you should know, that all prostate problems related to benign disease are not treated with surgery. We have very good medicines, and those problems can be tackled with medicine and maybe counseling or consultation with the doctor.
So, sir, very rightly pointed out that prostate can present either as a benign problem or as a malignant problem. But what is actually the real burden related to the prostate problems?
So, as I said, with increasing age, the benign disease, suppose if I say at the age of 50, almost 20 to 30% would have some symptoms, and by the age of 60 or 70, almost 50% would have such symptoms. So, this is for BPH or benign disease. When you come to malignant, the cancer of the prostate, now as you know that robotic surgery is a new buzz in our society, and almost 100 robots have been established in India. There is only one company in the world which makes robot, and we have 100 centers in India who are doing robotic surgery for prostate cancer. Because this robotic surgery was initially designed to treat prostate cancer. So, prostate cancer is a problem in India, but not as common as what you see in Western countries. Like, I can give you a simple stat. Like in the United States, out of 1 lakh men, almost 100 would develop prostate cancer. And if you compare that stat with Indians, then out of 1 lakh Indian men, probably 5 or 6 men would develop prostate cancer. So, we are fortunate that our incidence is not that high. Probably it is related to genes and the dietary pattern and environment. The diet plays a very important role. I think we would talk about that when it comes to prevention. So, that is the stat. But if you look at the population, like in the US, their population around 300 million and ours is 1.2 billion. So, even if that incidence is low, but the proportion of men presenting with prostate cancer is sizable. So, it is a problem which needs to be looked into. So, yes, it is a problem, and I think we should address it in proper way.
So, how do men know that they are developing prostate problems? Number 1. And is there anything to get screened for prostate cancer as they age?
Yeah, it's a very pertinent question. It's a very pertinent question. So, as I said, a man who has change in pattern of urination should seek an opinion from a urologist. And once a man visits a urologist clinic, he usually gets PSA done. When you talk about screening, now I must tell my viewers that screening means you are picking up any cancer in the body when it is not symptomatic. I mean, before it gives you symptom, you pick that cancer up. Like you take breast cancer, you have mammography or self-examination, or if you take prostate cancer, we have PSA screening. So, PSA is a kind of test which is done almost in every smaller or big city in India. So, this test gives us a clue that whether patient can have prostate cancer or not. In the US, it is usually prescribed as a screening tool after the age of 55. Like if you turn 55, you need to have PSA. So, it's called genuine screening. But in India, we don't have, and I don't think we need to have that kind of screening. But if you have symptoms, or if you have somebody in your family, your father or your uncle or your elder brother who has developed prostate cancer, then obviously you need to get your PSA test done. Otherwise, any change in peeing pattern, you should get your PSA done. And of late, I have seen most of the executive health check in corporate hospitals. So, they are doing PSA to screen for prostate cancer.
Okay. Sir, when we talk about surgery for the prostate gland, now there are so many technological advancements and robot is one of them.
Yeah.
So, what advantages does robotic surgery carry over the traditional methods?
Yeah. So, it's a very good question. You see, the prostate is as a gland which is deeply situated in the pelvis, bony pelvis. Pelvis is a part. Usually it is present at the mouth of the urinary bladder. So, it is quite deep into the pelvis. So, till we had robot, I think in 1991, we used to do with open surgery, then came the laparoscopic surgery. Fortunately, robot was designed for doing surgery or removing the gland with robot. So, I will just tell you the difference between surgery for benign disease, we call it BPH, and surgery for cancer. So, in BPH, we do not remove the whole prostate, we just go in through the urethra and create a channel. And in cancer, we have to remove the whole prostate and reconnect the urethra, the distal part of urethra as a tube for passage of urine to the bladder. So, that process is very technically challenging, and robot does help in carrying out a good surgery with good surgical outcome. So, I would say if somebody has prostate cancer and he is fortunate to have that cancer picked up early, the robot is the way to go ahead. The robot gives real advantage in terms of early recovery and long term complications in terms of bladder neck contracture. So, this is a proven fact that robot gives advantages in these two terms, in comparison to open surgery or laparoscopic surgery.
So, are there any problems also associated with robotic surgery?
Yeah, you see, no tool is perfect. So, as we say, it's not. I mean, generally people think that it's robot which does the surgery. It's not. It's we just take assistance from the robot. It's still the man behind the machine. It's the expertise of the urologist which counts. So, if you are not a good surgeon, and if I give you a robot, you may not do a good job. Problems with the technology is like it is deficient in a couple of ways, like we don't have a sensation of touch, and you need to depend on assistant who is assisting you and standing by the side of the patient, and you are sitting away from the patient and sitting at the console. Otherwise, I don't see it has problems in comparison to open surgery, but surgery as such, when you remove the prostate, there are a couple of side effects of the surgery. The two important side effects are a man, if he is sexually active, he loses his potency invariably to the tune of 50 to 60%, and incontinence to begin with, like after the removal of the prostate, they do have urine leak, which usually improves maybe in 95 to 96% of men, but 1 to 2% of men, if they are unfortunate and they have other adverse factors, they continue to leak even after a year. For that, they may need additional surgery to stop that leak. Yeah, so these are the two problems. We are working on it to reduce their frequency as much as possible.
So, thank you, sir. And the last question, that how can we prevent prostate cancer?
Yes, it's very good question. You see, all cancers have common denominators. I mean, health is a thing which money can't buy. You have to really invest your time and willpower, because you can't get health with money. So, keeping good health in terms of reducing your belly fat for men, because this happens to men only. The second, avoiding smoking, general measures which are good for general health, and reducing the carbohydrate diet, not consuming excess of red meat, chicken and egg and fish are fine. Regular exercise is very important aspect. Apart from these, I think one thing which I did this lab research study in previous institutes where I was working, Sanjay Gandhi Institute, what we studied that if a man is having frequent ejaculation in any form like masturbation or sexual activity, so he has slightly less chance of developing prostate cancer. So, more sex, more the merrier. So, more sex and the less chance of having cancer. And apart from that, awareness is the key. And as I said, if you have somebody in your family who has prostate cancer, then PSA screening is the key. You should check your PSA to pick it up early.
So, thank you so much, Dr. Anil
Pleasure.
Mandhani,
Thank you.
for enlightening us about the prostate problems, how we can screen for them, what is the right time to visit the urologist, and also to take second opinion whether benign prostate problems need surgery, and how robotics has revolutionized the way prostate surgery and the prostate cancer is being treated these days. Thank you.
Thank you very much. I appreciate that. Thank you.